expansion and scale-up phase. Your Excellencies, Dr. Dereje Duguma, State Minister, Ministry of Health, Ethiopia. Your Excellency, Dr. Fikru Regesa, State Minister, Ministry of Agriculture. In her absence, but she has sent us a recorded video, Her Excellency Ms. Afshan Khan, UN Assistant Secretary General and Coordinator for the Scaling Up Nutrition Movement, Ato Kokeb Misrak, Senior Advisor to the Ministry of Finance, Mrs. Anne Vitfian, I hope I've said that right, Vice President, Nutrition International, Dr. Usman Dion, Country Director, Eritrea, Ethiopia, Sudan, and South Sudan for the World Bank, Mr. Chris Nikoy, World Food Program Representative and Country Director, Ms. Eleanor Tanpienko, USAID Ethiopia Deputy Mission Director, Ms. Mariko Kahoshima, UNICEF Deputy Representative in Ethiopia, Dr. Taye Balcha, Program Director, Big Win Philanthropy, Mr. Andy Rigsby, Senior Program Officer and Nutrition Advisor at BMGF, Dr. Tefera Delbiso, Nutrition Project Coordinator at FAO, representing the FAO Country Director. Excellencies, ladies and gentlemen, all protocols observed. As I indicated earlier, we are here today for the launching event of the Resource Mobilization Plan for the Seqota Declaration expansion and scale-up phase. But first, a disclaimer on my part, because I am here standing before you as a self-proclaimed, I repeat, self-proclaimed advocate for the Seqota Declaration approach of doing things. And so I might be biased, but it is a very good bias. The Seqota Declaration is one of those approaches that has given us an example of what is possible in addressing nutrition and development simultaneously. And so we are here today with the following theme: to enhance the attainment of the Seqota Declaration's goal of ending stunting through joint public development, partners, investment, as well as with the government. For the Seqota Declaration, we have a very momentous objective of ending stunting for under 2 years old. We know what that means. It means better cognitive development for our children. It means better education outcomes for our children. It means better development, better economic growth. To do so, it will require a concerted effort of putting together resources of large enough magnitude for us to be able to address this goal. And so today, our objectives are two. One is to share the Seqota Declaration's resource mobilization plan, an ambitious plan aimed to take us to that finish line. Two is to increase government, donors, multilateral and bilateral technical and financial support for the expansion phase and beyond. The Seqota Declaration started in the innovation phase, targeting 40 warriors, and the expansion phase that we are in now was targeting 240 warriors. We are hoping to reach 334 warriors, which are districts, this year, moving on to 700 in 2026, and over 1,000 warriors, the entire country, essentially, by 2030. It's a big, big ambition, but also a worthy ambition. And so, welcome once again to this event meant to help in mobilizing resources for this very important goal for Ethiopia. But let me say briefly also that perhaps an example for other African countries to pick up on. So without wasting further time, I would like to now call upon Dr. Sise Sinamu, the Senior Program Manager for Seqota Declaration Federal Program Delivery Unit, and also San focal person, to deliver a welcome note on behalf of Ms. Hiwot Desene, the Lead Executive Officer for Nutrition Coordination and Lead Executive Office of the Ministry of Health. Dr. Sise, over to you.
Thank you so much, Namukolo. Your Excellency, Dr. Daraje Duguma, State Minister of Health. Your Excellency, Dr. Fukru Ragasa, State Minister of Agriculture. In her absence, I would like also to recognize Her Excellency, Ms. Afshan Kahan, UN Assistant Secretary General and Coordinator for Scaling Up Nutrition Movement. She will be delivering a speech and video recorded. And also on behalf of His Excellency the Minister of Finance, Ato Kokab Misraq, Senior Advisor to the Minister at Minister of Finance, Anne Whitven, the Vice President for Nutrition International, Osmane Deon, the Country Director for World Bank, Mr. Chris, the World Food Program Rep and Country Director, Eleanor, I would like to recognize the USAID Deputy Mission Director, Mariko, the UNICEF Deputy Representative, Dr. Taye, on behalf of Dr. Kaseta, the Program Director for Big Win, Andy, Senior Program Officer and Nutrition Advisor, Dr. Tafarra Delbiso, the Nutrition Project Coordinator, FPO, on behalf of the country rep. Excellencies, ladies and gentlemen, all protocols are observed. Welcome to the launching event of the Seqota Declaration Resource Mobilization Plan. As it was described, the Seqota Declaration is the Government of Ethiopia high-level commitment to end stunting among children under 2 years by 2030. It builds on and catalyzes the implementation of the National Food and Nutrition Strategy by delivering high-impact nutrition-specific, nutrition-sensitive, and climate and nutrition-smart infrastructure interventions. After successful completion of the innovation phase, the government has kicked off the expansion and scale-up phase in 2021 with the aim of reaching more vulnerable waradas and households through multi-sectoral food and nutrition interventions. Currently, the third year of the Seqota Declaration expansion phase is operational in 240 waradas. On January 1, 2024, based on the Seqota Declaration expansion and scale-up phase roadmap, and also informed by the promising progress the program has achieved in averting large number of children from stunting and deaths, the high-level Ethiopian government leadership has approved to add additional 460 waradas to the expansion phase implementation in a phased approach to further accelerate the stunting reduction in Ethiopia. We aim to reach 700 waradas in the coming 3 years period, which requires intensive collaboration, resource mobilization, and also technical assistance for successful delivery of the program in 700 waradas. Excellencies, ladies and gentlemen, the Seqota Declaration roadmap indicates that over a 10-year period, scaling up the high-impact interventions through the 8 strategic objectives would cost a total of over 4.5 billion USD, funding both the expansion and scale-up phases. Mobilizing these resources will improve access to healthy, nutrient-dense, and diversified food production, market accessibility and food affordability, feeding and healthcare practices, safe water and wash practices, school health and nutrition practices, social protection actions to strengthen the resilience of communities, women empowerment, and gender equity through multi-sectoral governance and effective coordination. To facilitate the resource mobilization efforts from diverse sources and ensure sustainable financing for the Seqota Declaration, the government and its development partners developed the resource mobilization plan that we are launching today. This plan has established 3 sustainable financing goals to help achieve the funding targets that we have put. To mention them, strengthen multi-sectoral financial management to improve nutrition outcomes and evidence-based decision-making, increase sustainable funding sources by engaging with existing and new and innovative stakeholders to fund the Seqota Declaration, and third, mobilizing 3.86 billion USD over the next 8 years to finance the expansion and scale-up phases. In this regard, today's Seqota Declaration Resource Mobilization Plan launching event will enable us to enhance the attainment of the Seqota Declaration goal by ending stunting through joint public and development partners' investment as outlined in the theme of this event. Having said this, I would like to welcome you again, and we look forward to a productive launching event and engagement. I thank you.
Thank you very much. Thank you very much indeed, Dr. Sise. Now, we often hear about moderators' prerogatives. So I have changed the order in which the speakers are going to speak. And it's all in the spirit of encouraging all of us to think about how we can invest in terms of nutrition as a part of this process. So I would like to first call the next speaker as Ms. Mariko Kahoshima, UNICEF Ethiopia Deputy Representative Programs. I know that she has a meeting to run to, and I don't want to let go of her. I would like her to express her commitment before she leaves for her meeting. Ms. Mariko, over to you.
Thank you so much. Good morning, everyone. Your Excellency, Dr. Dereje Duguma, State Minister, Ministry of Health. Your Excellency, Dr. Fikulu Legasa, State Minister of Ministry of Agriculture. Ato Mislak, Senior Advisor, Ministry of Finance. Ms. Ann Whitvin, Vice President, Nutrition International. Ms. Eleanor Tambienko, USAID, that I have a pleasure to meet 2 days in law. Dr. Sisei Sinamo, Seqota Declaration Senior Manager, Ministry of Health, who is doing all this wonderful job. Representative of government sectors, ministers, representative of donors, representative of UN agencies, civil society organizations, distinguished guests, ladies and gentlemen, it is a great honor for UNICEF and for United Nations System to be here with you at the launch of the Resource Mobilization Plan for the Seqota Declaration expansion and scale-up phase. This important milestone allows us to take stock of our achievements, next steps, and importantly, the investment required to end stunting among children under 2 years of age by 2030 and advance the nutrition agenda in Ethiopia. The Seqota Declaration demonstrates bold commitment by the government to end stunting. This program accelerates and catalyzes the implementation of the multi-sectoral food and nutrition policy and strategy, food system transformation agenda, and other governmental-led initiatives, including Yelemet Tafat, aiming at improving the nutritional status of women and children. This innovative program is well recognized globally as an example to enable government's commitment to end stunting by 2030. On behalf of UN agencies, I wish to congratulate the government for a successful completion of innovative phase and initiation of the expansion phase of the Seqota program. Despite the progress and achievements, children in Ethiopia continue to suffer from high level of all forms of malnutrition. Nearly 6 million children are suffering from stunting, representing 4 out of 10 children under 5 years of age, which is higher than the average of African region, that stands 3 out of 10. Stunting, as you all know, impedes children's cognitive development, limits their potential to function fully, and ultimately affects their contribution to economic productivity. Hence, childhood stunting remains one of the most significant impediments to human development in Ethiopia. Ladies and gentlemen, evidence indicates that the impact of stunting is irreversible. Therefore, Ethiopia's future economic prosperity and social development and its aspiration for middle-income status depends largely on the investment towards prevention of stunting. $1 investment in stunting prevention has been shown to have a return of investment of $16. Failure to invest towards prevention of malnutrition is more costly. According to the Cost of Hunger study in 2009, Ethiopia loses 16.5% of GDP every year due to malnutrition. Therefore, the government is making the right choice to prioritize investment towards prevention of all forms of malnutrition, including stunting reduction. The Seqota program demonstrates the impact of the investment in stunting reduction and saving lives among children in Ethiopia. Distinguished guests and ladies and gentlemen, there is more work remaining to be done to end stunting and all forms of malnutrition in Ethiopia. There is urgent need to invest in resilience building for nutrition and food security, given the protracted emergencies faced all over Ethiopia the last few years. Therefore, prevention must not be separated from our humanitarian responses. And the government is already leading efforts to address the humanitarian development, peace, and climate nexus agenda. We are enthusiastic to see all Ethiopians have optimum nutritional status, quality of life, productivity, longevity, etc. Hence, there could not be any other time better than now to strengthen our collaboration among donors, government sectors, and nutrition partners, and CSO towards achieving our goals to end stunting. As we advance, we need to emphasize the following 3 key areas. 1, enhancing public financing for nutrition and innovative financing approaches, especially from the private sector. This requires parallel efforts to improve tracking and monitoring of allocations and optimum utilization of budgets for nutrition across sectors. And then I really would like to congratulate Ministry of Finance, with whom we have just met and then started to talk about tagging